Hello. So, yesterday afternoon I was sitting in my clinic, I was done with all my work. A young man who was really good looking, handsome, walks into my clinic, does all the initial formalities, fills up the form, is very, I can watch in my camera that he is very anxious and is not really focused or is really having some fear on his face. He was looking here and there and was quite worried. After doing all the initial formalities at the clinic like filling up the form, sanitizations, he walks near my cabin and I tell him, "Hello sir, can you please have a sit?" That time he said, No. I want to first talk to you." I said, "Okay, come, let's have a word." That time he said, "See, I have listened, I've heard that you are avoiding root canals in patients and you really do treatment well. So I want you to avoid treatment. In my case, I don't want you to do the treatment." I said, "Okay, but how do you know that there is any sort of treatment in your case?" That time I said that, "See, I have one hole in my right side, one hole in my left side, and one is for filling, the other is for root canal." I said, "Okay." So that time in my mind I knew that this patient has already visited 2 or maybe 10 clinics around, and now after doing a lot of survey about me and my treatments, and he's come down here. So now I was very much under pressure. Now what is to be done? But still I said, "Okay, let's be patient with him and let's try to know that why he wants to avoid treatment or why he wants to not have any treatment." So was my question for him, that why you don't want to have any sort of treatment in your mouth. He replied that he has heard that dental treatments do more of harm than good to your teeth, and hence he does not want to harm his teeth and want to avoid all sort of dental treatments. He was pleading me that please avoid treatment and please do not do any treatment, and tell me how can I without treatment cover this holes up and have no pain at all. I was like, okay. So after some discussion with him, which I am going to discuss it with you today, he agreed to do the treatment. So come, today let us have a look at what was the discussion.
Subscribe to my channel to know about dental facts and tips.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, as you all know, we are discussing today about a hole or a cavity in the mouth. So first let us know that a hole or a cavity in the mouth is formed by the demineralization process of a tooth. That is, the microorganisms in the mouth and the sugar from your food, they come together. The microorganisms enjoy the sugar in your food, and in that process they excrete an acid. This acid causes harm to your teeth. So this acid, which has created an harm, creates a hole, and this hole is nothing but the demineralization of your teeth. The minerals in your teeth, the one which are very commonly acquainted with is calcium, phosphorus, etc. So these minerals, they come out and that creates a hole, a black hole which is seen. The first initial procedure in which the demineralization, there is a small whitish thing which is very commonly seen in small children. In this stage, yes, you can remineralize that with fluorides and certain pastes and certain treatments which are available at the dental clinic. With this, without any treatment, a remineralization of the teeth can happen. The holes can be covered up. But after one point of time, these holes cannot be covered up. These holes which are forming a pit or a depression in your mouth, they need to be filled. But for their filling, they need to be excavated. The microorganisms, the acid, everything, the dirt which has been formed there, that has to be removed. Now, if this hole is in the initial first 2 layers, a filling can be done. But if this hole is in the 3rd layer, which is the pulp, a root canal procedure is required. So friends, remember that a hole in a mouth or a cavity in your mouth cannot be. It cannot be just avoided. And if you're thinking of avoiding it, then be ready that the tooth will someday get damaged and broken up. So friends, the next question of him was that if this cavity is doing any damage, I'm not having any pain. In the initial days I was having pain, but now it is just food lodgement issue. Now I don't have any pain. That is because the stage of chronic disease is achieved. So once the tooth tissues become dead, that time you cannot really feel pain in your mouth. And that is a condition in which there is more damage, more eating up of your tooth, but there is no pain in your mouth. And friends, filling up your tooth or getting a root canal treatment done, it is not that dangerous. So if you're thinking of getting any treatment done, make sure that it is quick and it is fast, because more you delay your treatments, more the damage to your teeth. So friends, if you're having any questions related to your dental issues, or if you're still having a fear of visiting your dentist and getting your treatments done, make sure you mention it in the comment section below, because I am going to address it to you and we can have a one-on-one talk, and I'm sure you will get rid of the dental fear. If you are liking my videos, give a thumbs up. Do like, comment, share and subscribe to the channel Dr. Mansi Shah. I'm a dentist practicing in the city of Pune. If you want to visit me, then here is my email address. You can contact us there. I hope by watching this video you have got to know that yes, a dental hole cannot be avoided. It has to be treated in the right time. Wishing you all a very happy and a healthy smile. Be happy, be over fit. Thank you. Take care.